Sure. Hi everyone, I'm Aurora from Taipei Tech. I'm very glad to welcome all of you to the MIT City Science Summit 2021 co-hosted with MIT City Science and Taipei Tech. And this workshop is hosted by CSL at Ho Chi Minh City. They will focus around their topic, transformation within cities. And I'd like to remind you that this workshop is recorded and live streamed on YouTube. So you might see an account called Livestream CC as you're going to join your breakout room. Okay, now I'd like to pass the mic to Tuan. Hi, Tuan.
So hello, welcome everybody. So thank you very much for warmly welcome us here. That we also have the panel discussion that also can organize by Vietnam and collaborate with all of our CSL around the world. So we feel very happy. So I think if you all feel okay, so we would like to invite you to enjoy our panel discussion. Then we can start. Thank you very much. Hello, everyone around the world. Hello from Vietnam. Welcome to the Transformation Within Cities workshop. This workshop is organized by City Science Group at MIT Media Lab and the City Science Lab in Ho Chi Minh City, Vietnam. My name is Tu Anh. Now I'm Director of the Institute of Smart City and Management, ISCM, University of Economic Ho Chi Minh City, also one of the partner of the CSL Ho Chi Minh City. I will be your moderator for today's workshop. Just a quick introduction before we are running into the presentation. City Science Lab in Ho Chi Minh City, Vietnam is the youngest lab in the City Science Network, which only established a few months ago from Jan 2021. CSL Ho Chi Minh City is a collaboration between the MIT and Architecture Research Center, Ho Chi Minh City Department of Architecture and Planning, which partner with the ISCM, UHMM Lab, VLab, and Sunny World at TMC. Ho Chi Minh City Lab focus on applying the Cityscope application platform to simulate and research urban development and planning in Ho Chi Minh City. We are working closely with the local authority to promote innovation approach in urban planning and design. Today, the workshop would like to share ongoing research as well as get feedback from the local and also international leader, planners, scholar, researcher, experts. Then we can continue developing innovative platform and technology application from the perspective of planning, design, and management to contribute to city resilience and sustainability. Thank you very much to all of you for joining our workshop today. Hùng Nguyễn. So today the workshop is divided into three parts. The first one, which will begin shortly by the four panelists sharing to give the context and the key idea related to the theme of the workshop. In the second part, all of the attendees will be random divided into breakout rooms where we can discuss to better understanding the topic of the workshop. In each room, one of our organizers will shortly explain how we will discuss and guide you through the discussion. After the finishing of the discussion, All of us will go back to the main section, and each group will have the 5 minutes to summarize the discussion. In the last part, we will have the Q&A section to help you explore more about the topic of the today's workshop. You also can type the questions in the chat box or Q&A section of this platform. We will proceed to the panelists. To get a valued discussion in the group discussion tab, kindly change the title appear in the platform as your name and your country. Many thanks for your support. That's all about the general information about our workshop. I hope that everyone will have the good time and also enjoy our workshop. Okay, let us begin with the panelist sharing now. In the first part, we will have the Mr. Kian Wu. The first one will be present our panel discussion. Mr. Kian Wu, he is the vice chairman of the Binh District People Committee and also co-founder of the CSL Ho Chi Minh City. His area is a disruptive initiative in urban planning and management. He has been participating to urban planning information, disclosure project and other projects to make urban planning and more transparent in Ho Chi Minh City. The second presentation will be given by Mr. Hai Huang, the coordinator of the CSL Ho Chi Minh City, a young and very dynamic person in the field of the urban planning and design. Then we will have the Mr. Jin Yu Yao, the Director General in the Secretariat of New Taipei City, the largest city of the one major city of the business industry in Taiwan. Prior to this role, she served as Executive Secretary to the Taipei City International Affairs Advisory Council and Mainland Affairs Council, and also some other areas and high positions in some countries. Last but not least, Dr. Phạm Thái Sơn, Senior Lecturer in the Urban Economic, Sustainable Urban Development Master Study Program in Vietnamese German University. He also had a lot of experience in many local and international urban development research and projects. He has a lot of experience in many local and international projects. So I also very happy to have the 4 experienced and young mindset panelists here. Thank you so much for your contribution. To all the panelists, you will have only 10 minutes for the sharing your topic. I know that it's too short, but I'm sure that you also agree with me that the more discussing time will be the best for all. So please keep the presentation in time. Now we will start the sharing series with Mr. Kian Wu with the topic title, Transformable Urban Planning. Mr. Kian, here is your stage. Welcome.
Thank you, Ms. Tuan. Good morning and good evening to everyone. As Ms. Tuan introduced, I'm working as the Vice Chairman of Binh District in Ho Chi Minh City. This is the hostess place in Vietnam regarding to the COVID-19 pandemic. So today I would like to share the story about changes in my district during the pandemic regarding to the urbanism. And I would like also to share my proposal for the post-pandemic urbanism in Ho Chi Minh City. So this is a brief introduction about my district. Binh Tân district has the area as 52 square kilometers and the population as 784,000 people. This is located at the west of Ho Chi Minh City, and it has the highest population. It's the highest population district in Vietnam. Especially more than half of its population are immigrants. And during the COVID-19 pandemic, the district has been impacted heavily with more than 66,000 cases and more than 800 people dead by the virus. And this is the district that has the highest COVID-19 cases in Vietnam. And to deal with the COVID-19 pandemic, there's a lot of change have been made in the district. At the peak of the pandemic, we have 19 quarantine centers, that hosts more than 6,000 people. And we also have to accommodate more than 1,000 supporters from other provinces that came to Madrid to help us. So a lot of building has been requisitioned for the use as facilities for activities related to the COVID-19 pandemic. In this slide, you can see on the left picture is a school that has been transformed to become a quarantine center. And on the right hand is another school that has been transformed to become a field hospital. Besides public building, private buildings also requisitions to serve for the fight against COVID-19 pandemic. This is a shopping center and residential complex that has been transformed to become a field hospital for 1,000 patients. And another cases is the story of factories that had to transform some part of their facilities to become temporary accommodation for workers to meet the on-the-spot policies of Vietnamese government. It means that workers have to live, work, and quarantine at the same place. So, besides those cases, actually, there are very few buildings has been transformed. Why is the need for the land and spaces for accommodation and health facility is huge during the COVID-19 pandemic, and a lot of building has been left vacant. So what's the problem? From my point of view, there are three main issues. The first one, most of buildings are untransformable. It's been most of them has been designed and built to fit with a function, and nearly impossible to change their function. The second issue is the cost to transform the function of a building and then change it back after the pandemic. Like sometimes a factory was proposed to have their warehouse to become a field hospital, but they can do that. But after the pandemic, it also takes a lot of cost to change it back to the original function. That's why it made most of the people hesitate to do that. And the last but not least, the problem is the rigidity of urban planning system in Vietnam. Regularly, if you want to transform a building function or make a new building, they have to suitable with the zoning plan. Like if you want to transform an office to an accommodation, it's something illegal, and it has to change the zoning plan, revise the zoning plan before you can do that. Or if the government, even the government want to build a field hospital on an industrial land, it's impossible regarding to the regulation. So the urban planning system in Vietnam is based on that's a paper-based system, and the procedure to make and revise urban planning usually takes a very long time. Like for zoning plan, it usually takes 3 to 5 years to be approved. And if you want to revise a zoning plan, it also takes you about 1 year. But during the COVID-19, you don't have such much time to do that. That's a problem. Yeah, and the zoning plan in Vietnam is also built in a static 3D 2D format, and the two images that you are seeing in my screen. The left side is a illustration of the SCM Ho Chi Minh City CBD zoning plan made by the urban planners. But I try to make the real visualization of that plan based on the city ancient tool, and see a totally different images of the city. So somehow even urban planners feel hard to imagine and illustrate their work correctly. So From all of those problems, I see that the pandemic has revealed the weakness and resilience of Ho Chi Minh City urbanism. And it's very clear that the city needs to have a new approach to urban planning. And I come with a hypothesis for the post-pandemic urbanism for Ho Chi Minh City, that Ho Chi Minh City should be more flexible and resilient to adapt with unstable development trend in the future. And the city must be able to transform sustainably to survive, adapt, and grow through on-shock and stress. The urban planning of the city is built, managed, and revised at a high level of flexibility through an interactive platform, but it's based on data that allow all stakeholders to engage. And I named this concept transformable urban planning. So the methodology is, the concept is developed based on the three pillars which adapt the central world of Bình Tân district. And I use the City Engine as a software. It used as tool to make procedural modeling. Somehow I use the Kotlin programming to generate the building instead of make it manually. And this is a short video that I recorded about the process. I use the GIS data and database and use the CGA programming to generate the urban models of the whole world. And by that tool, I can tell a story about what happens in Bình Tân during the last some months. On the left is the current zoning plan. You can see the education building there. And during the pandemic, it's changed to become a public facilities. But I propose to have something better. That is, if we can design it in advance, and we can have a transformable use. It means a space that can be transformed to different uses according to deal with different situations and scenario. It will be better if we, rather than we change this in negatively. And by using City Engine, I build a dashboard to manage and interact with zoning plan. In this dashboard, you can see all of different scenarios and with different parameter, and you can see how it changed the parameter, and like in the right hand is the scenario with the height is the transformable area, and in this dashboard, stakeholder can work together to find the best solutions for the city. And this approach can be used for not only for zoning plan, but also for the project scale. And this is an example. And how I use the this software and try to change build different scenarios by changing the parameter, changing the typology, and each parameter like BCR or FAR or building story. And see how is the impact, how it will impact to the projects, like the populations or the transformable areas or the proportion of different use of the project. You can see when I change its scenarios, the dashboard below is changed simultaneously too. And I think this is a good way for urban planning, at least better than what we are doing in Vietnam. Thank you for listening.
Thank you very much, Mr. Kian. This is a really interesting topic where we can get more information about how to dealing with the COVID-19 and urban issues planning. I guess that with the Mr. topic really inspire us for some solution to approach for contribute a better city resilience. Continuously with Mr. topic, I would like to invite Mr. Hai Huang to share mobility transformation for supportive decision making. Hello, Hai. The stage is yours now. Welcome.
Thank you, Mr. Wan. Thank you for having me today. I'm very happy to kind of present of the group work. So let me share my screen. Uh, I hope that you all see my screen, right?
Yes, very clearly.
Okay. So the topic is within our power mobility within the city. How do we do? And the city and mobility is two sides of the coin. How those affect to each other, and that is a local and also in global scale. And I take District 4 as a case study in the pandemic. So as we already know a lot about the COVID and how the COVID affect to our normal life, and now it's not normal anymore. So it's the new normal, and everybody's saying about that, and it's really a certificate for all of us. And for the localized of Vietnam, we evaluate three groups and challenges for three groups. So the first group is citizens or the communities. How the pandemic affects that? How does the barriers and isolation affect to our people? The other group is authorities. How can the authority decide where to put the people or distribution of the human resources to that? And the other pillars is a company or entrepreneurship. How can we still running in the new normal? How can the employee and employers still working in the same situations if this not gonna change anymore? So taking into that, we taking to the collaboration with MIT, and we explore those into District 4, and we take four cases. The one case is all normal, like we taking into like the areas as normally, and as we can see, the District 4 is quite of like in the unique position where located and surrounded by the river. So it affects you, it giving you very like a strong characteristics of the areas, and the mobility is very unique in this area. The case two is like when the whole District 4 is locked down word by word, and how do we evaluate those? The case three is we evaluate if those was in lockdown only and with the lowest density. And the case for the final case is the higher density, where those only the most density of the people living. So we calculate the accessibility, and the accessibility that we think in the pandemic is the most basic, and the normal amenity is providing food and medicals. As we can see here in the normal life, the accessibility for the market where providing food is part of like the same way. But as you can clearly see on the case two, where the whole district is locked down word by word, it's very fragmented. The area is divided. So it's some area is not accessible to the other one. And at the same principle that in case three and case four, that we can see in some area is very isolations, and it's happening in real life. How about the hospital where we have a COVID cases? They have to go to hospital. So in those isolation, how do we evaluate that? Is there any hospital in those area? Is there enough human distributions for that area? And again, in the case to where it's the fragmented happening again, and it's clearly see that. So how about beside the pandemic, like the the quality of the hospital it decreased because there's so many cases that in the infrastructures is not good enough for the people. So the people have to buy their own drugs and to take their own medicines to take care of that, to take care of themselves, take care of their family. So with those, we seeing like in each cases, like providing amenities, which areas is enough, which area is not enough. And so providing those information for the authorities and for the people, they already know, okay, we have to take something to do something about that. So, and in the end of accessibility, that giving you the sense of the isolation areas, the separation areas inside of the limited area. How about mobility simulations and how does affect the other group? So as all normal where everything is happening, we have like this, and two key things that we may want to point out is this row and this row, and this. So as we can see that the men normally the people take this row and this, and the other row is that on the south in the district 7. Meanwhile, when we lock down the whole areas, which road going to be heavily used and where is going to be a potential chaos? So giving these pictures, the authority will know, okay, if this happening, some area has to have some special policy for that. How do we support those changing, and those change affect to the other? So it's not only affect to the inside of the lockdown area, but also in happening and affect to the outside of the areas. Uh, and then we take into the world where the main role is used the lock, then we can see the people take this role instead of that. But the point is here is that not only this role, but the point here is also really heavily. So in this point, this cluster also giving the hint, initial hint to the to the people who make decisions that they may have to have some consideration for that. So in all, we if we have some policy for that, let's say even in the case of the whole district 4 lockdown, if we still giving the right for the people to passing through, if we think that with our knowledge, we see that this is the main road and we allow only the people to passing through, but not accessible for that, how does that affect? So that you can see like the other row is now been so much uh, dedicated to that. And then we calculate some indicator, very simple indicator about travel distance, travel time, and human resources. So with the case of the old time where the travel distance and travel time is normally, and then when we have the whole district locked down, we seeing that the people will travel a lot further, and it take much more time for that, and the road will be heavily used. But if we provide some policy, the authority giving you some other like treatment for that, it's kind of balancing of those. But the disadvantage of this solution is that the government has to have more people to maintain those this, uh, this special treatment for that. So finally, I think in our in our pandemic, the idea of having quick decision is really important because it's happened so far. The people been affected so much, and the other criteria that we have think is efficiency for all. It's not only for the group of the people, it's affecting the other group. And of course, the convenient and economically. So with those 4 criteria, I think like this platform, open platform with the collaboration with MIT, I think like it's bring the people together. So in 2020, where the COVID already spreading out, before that, we're talking about integration, the people coming together, people happily together. But after that, we have a separation. We have the people keep safe, stay home. So how does that change our life? So with those openness data or the accessible to the platform open for everyone, the balance between the indicator is required for quick simulation output, and those output affect all of us, affect not only you, not only me, but the other people. So by providing clear and quick simulations is very important. And then the people come together, decide where to go and how to go. So thank you for all of you today. And the final say that I want to say is within our power, everyone has the role to play. With this platform, with this collaboration with MIT, I think like Ho Chi Minh City will take advantage of that. Collaboration with the other lab in around the world and bring the power together and bring the better life. Thank you for your time.
Thank you, Mr. Hai, very much for keeping calm. Sorry for hurry up. And also, it's truly a necessity that we have to think about how to cope with the pandemic, especially in the Vietnam context, and dealing with the data and local context to support timing and efficient decision making. Really important. Thank you so much. And following the topic, I would like to invite Mr. Chinh Yu Yao to share her points in the term of the pandemic. New Taipei, new normal. So, Miss Chinh Yu Zhao, it's a pleasure to have you here with us today. The stage is yours.
I think you are mute, Yao.
Mr. Yao, you are mute. You need to unmute. 我们没有听到你
Yes,
讲。
you still unmute.
Is it better?
Yes.
Perfect. Okay, welcome back.
So my presentation compared to the two previous excellent speakers will be a little bit low tech. And this tree is a real tree as well. So it's great to see Chuan again, and great to see Dr. Ken Larson again. I'm here to provide the perspective from a city government and hope to give input to such a great workshop. And also I'll share some of our findings for post-pandemic urban challenges. First about the pandemic. Taiwan did very well in the pandemic prevention last year, with no confirmed cases for 252 consecutive days. However, in April this year, the virus came through our borders and entered the community, becoming serious in mid-May, as we get hundreds of new cases every day. Of course, compared to Ho Chi Minh City, we are still relatively okay, but jumping from 0 to hundreds of cases is a big change for our citizens. Especially New Taipei City is the most populous city in Taiwan. Plus, our location is between the capital. Let me check our. Our location is between the international airports and our capital city, Taipei. So traffic definitely passes through. This factor had a big impact and make things more challenging for New Taipei, especially in May. Back in May, the vaccine penetration rate is less than 3% in Taiwan. So the situation is really critical. That's why in June, our mayor, Ho, who is a former detective police, has activated a new initiative called the Pingning Project. Pingning means peace. There are the only one mission in this Pingning Project is to integrate prevention and control measures against COVID-19 in our local communities. And these are the three principles. First, science-based. Two, bottom-up. Three, people-centered. And this initiative is not to create any new institution, but to mobilize three key government decisions. One is the city government's district office. Two is the community healthcare center. Three is the regional police stations. The district officers receive guidance directly from the mayor and coordinated civil and social welfare affairs in the neighborhood. Then healthcare centers carried out the public health policies, and the regional police office, the law enforcement, performed in-depth investigation to fill in the apparent gap of contact tracing. And the district officers also provided a very important mission. They need to provide assistance to the low-income families who are affected both by the virus and poverty. With the support of the above agency, the healthcare centers then could focus more on medical readiness and preparation without stretching their manpower too thin. So luckily, in spite of the low vaccine coverage, in less than 60 days, the number was able to be brought down from 3 digits to single digits. At that time, we're also the only city in Taiwan to set up free rapid testing services to all citizens, regardless of their residency. So we have about 40 of these pop-up rapid test centers. Based on the results, people then can be provided with necessary assistance. For example, transportation and home quarantine, because all these are so important to prevent greater community infection and to protect more citizens. In many ways, our city's implementation of COVID-19 response was far more aggressive than that of the central government. And more important, I think our key to success is to involve broader citizens' participation. For example, we're encouraging citizens to take the free testing. And so far, we have provided more than 200,000 free tests to all the citizens. And that helps a lot in our crowd control in the wet markets. And more importantly, with the broad citizen participation, trust is being built rather than collapse between the government and citizens. And this is very important because we still have a long road ahead of us to prevent pandemic. And also, it's quite common worldwide that disagreements in pandemic prevention controls between the local and central governments. But as we can see from the acquisition and distribution of global vaccines, we can see that the national governments usually have to spend a lot of efforts in geopolitics and national borders. So cities and leaders, I think, are proven to be more and more important than ever. And we think that applies to economic recovery too, because pandemic now becomes a twin pandemic. It affects our health. It also affects our economic. And according to everyone now, according to UNCTAD report this year, it's gonna take a long time, several years, to a full economic recovery. But what is governments like us are thinking now is what are our priorities? We need to rethink about how to recover. As you can see, the impact on COVID-19 and the economic growth is highly correlated from this data. But what we want to suggest is that, for example, Taiwan is an export-oriented economy, and it so closely connects to the world economy. New Taipei is also very important in the GDP share, especially in high-tech industry. We're home to big names like Foxconn, Acer, Microsoft, Google's largest R&D base outside of the USA is also in Taiwan. But when we're talking about Build Back Better, we can't just look at the growth rate or GDP, because the pandemic hits local economy and industry very differently. Let me show you this slide. So some of the sectors are thriving during the pandemic. Let me name a few: semiconductor, cargo shipping, PC, related device production, biotech, etc. But others, like wholesale, retail, hospitality, food and beverage, tourism, and passenger transport are not. They are negatively impacted. And what are the differences between these two sectors? Because the second sectors hire large number of people. So instead of GDP, you look at the unemployment rate, most people are suffering. So this is the picture, the beautiful tourism destination in New Taipei. And to the right-hand side, you can see these are very small vendors. Of course, all the city want to grasp this opportunity to turn crisis into opportunity and making sure that all the business going digital. But look at these small shops. How do they go digital? We want to help them, but how? Because of the time, I'll give you 3 completely different going digital examples. The first one is tourism. Vendors with Google. They have a plan called Grow with Google. So they can help this small vendor to pin their location on their map. And the second thing I want to discuss is in a thriving city, you cannot go or live without art. But how about art going digital? Is it possible? We have tried everything, but I especially picked this picture. Art, you there. There's a lot of digitalization is against the very nature of art. So we still yet cannot find a solution. The third successful digital platform is our Resilient City platform. And this is successful, is for the city flood control. I'm not telling you this is something new. This is something successful because we did not spend a lot of hardware infrastructure investment. Instead, we connect 4 independent systems together, including road flooding sensor, rainwater channel level monitoring, pumping stations, and cable TVs, CCTV. We integrated all these 4 systems together. Plus, we have recruited a lot of flooding volunteers from communities. And why this can be successful? Because this digitalization has gone for many years. And during the pandemic, we were able to complete this project without delay. So again, broader participation from the citizen is very important. I just wanted to close our conversation by telling everyone, just like the 3 examples I'm telling you, city leaders are so busy nowadays, like Tuan, right? We have to reimagine a whole city, livable city, with sustainability in mind, with people in the center, while tackling the health impact of COVID-19, dealing with climate change, ecological emergency. Also, we need to think about what is our home of tomorrow for our citizens. That's why back in this April, on Earth Day, our mayor works with Dr. Ken Larson, the director of MIT Media Lab for City Science Lab. We created this Home of Tomorrow competition. And on the left-hand side, you can see this picture. It's an old urban neighborhood, and it's the first prototypical site to identify solutions that will enable us a more resilient, people-centered, and high-performance community. And we also identified 4 very important actors in creating a fun, sustainable, and thriving city in this competition. The 4 categories are architects, urban planners, scientists, and very important artists. And we are really looking forward to see this competition can travel around the world. And we're so glad to be part of it and to be the first city to initiate this project, and excited to see the competition results. Again, I have to tell you that this is why New Taipei City is going to publish our second VLR, SDG VLR, by the end of this year, because like the City Science platform and today's workshop, it is so important to continue supporting each other, because I think the essence of sustainability is partnership. And stay tuned. I hope I'll come back and share more about our SDG VLR and our city challenges and solutions with you. Thank you.
Thank you very much, Chin Yu Zhao, for your very, very interesting topic. So I also agree with you that now the city is too tired because have to facing with many types of the city, and also have to adapt this, and also to have to go like smart or the human centered or dealing with a lot of the climate change and everything. Is really, really very, very hard time. So thank you very much for short time sharing with us a lot of the information. And I also like the idea about the competition, because here we also make the one international competition like this with the smart city for the urban design, how we have to think and make the city really totally different after the pandemic. So thank you very much. So now, the last but not least, please welcome Dr. Park Thái-Sơn to the stage to share the topic with the title "Build Back Better: Two Bucket Lists and Four Pillars for a Resilient Ho Chi Minh City." Welcome.
Thank you, Ms. Tu Anh, for your warmly introduction. So hello everyone. At introduction, my name is Phạm Thái Sơn, and I'm working at a senior lecturer for the Vietnamese University in the Sustainable Urban Development program. And I'm also collaborating with the City Science Lab as an advisor for the three working team to give some external advice for their work. So I'm happy that I can be the last speaker for this very interesting session, because I see that there's some kind of preparative introduction from the previous three presentation from the three inspiring speaker, including some concept and some keyword, some context that I do not have to repeat. So briefly, my presentation will focus on a very brief summarizing on the situation of Ho Chi Minh City. Based on that, I will point out the two key or critical bottleneck of COVID-19 pandemic control in the existing situation of Vietnam. And then I will also, based on the resilient framework, to propose the kind of the action plan based on the four pillars of Ho Chi Minh City to deal with the pandemic. So you might know that it's still ongoing and changing number for Vietnam and for Ho Chi Minh City. And I provide also kind of the lower level example regarding Bình Thạnh district is also a very kind of hot area beside Bình Tân that Mr. Kiên present at the beginning in Ho Chi Minh City regarding the number of cases. I want to summarize the kind of the key critical number that shows the city, the serious level of the pandemic in Ho Chi Minh City, regarding the ratio of death per positive case. It's very high compared with the existing situation worldwide. The existing situation, the ratio of death and versus the case is about 1% worldwide, but we still have a much more high, double or triple, 3 times higher or even 4 times higher compared with the existing level in other countries. And also we see that in the level of the city, the district, and the ward that I'm living in, we have a very high level of infected people, up to 10% within the ward that I'm living. So I mean that 100%, and we have a 10 positive case, so it's very high and very critical and challenging situation. Here just summarizing cap trend regarding the number of cases and number of deaths in Ho Chi Minh City. So it is just we can see that the very kind of rapid increasing of the case during the last 2-3 months that caused a very heavy situation of the healthcare system, the overload and a high number of deaths involved in COVID-19. Sorry, I know it's a little bit busy. And we can see positively and happily that we are in a much better situation during the last 2 weeks. because we can observe the trend of daily number that had been decreasing during the last Sunday. And one thing that I want to highlight right now, the city authority as well at the central level is still, I mean, struggling to build up and to propose a comprehensive risk assessment that can be kind of the evidence-based guide for the action plan, the precise plan at on administrative level of the country, including the city, the district, and the ward, for example. And we can see that it seems that we have just a very quick overview on the number of documents issued, and we see that it's very relevant to the different outbreak happen in Ho Chi Minh City in particular, and in Vietnam as a whole. And we can see that Ho Chi Minh City and Vietnam is not really proactive in dealing with the situation. Whenever we have outbreak, then we will try to find out the solution and propose some action guiding by the issuance of many documents. So somehow we missed some opportunity to prepare for the potential outbreak in the past. Here, sorry, I do not have enough time to translate it, but you can see that from the end of May, the city the city authority have been applying certain level of lockdown continuously. Normally, after every 2 or 3 weeks, we apply a new level of lockdown in Ho Chi Minh City up to right now, and we hope that in the upcoming week and month, the city can be really free with the COVID-19. We will have a new normal. Here, just some data showing the very serious level of impact of the pandemic to the citizen. There's a lot of people losing their job, so they don't have any income, and they receive very little support from different sources, mainly from the family, but or from a kind of civil society, but from the state and from kind of the very official support from the local authority, just a few. And also we identify that the poor area and the vulnerable area and group were, I mean, have been strongly affected by the pandemic compared with the middle income and high class area. And based on the data and based on the information that we have, we identify the 2 key bottlenecks. The first one is the lack of data that can support the city authority to monitor different aspects of the pandemic. Therefore, we are lacking of the evidence to inform the decision-making process. And also, there is a lack of data that cannot provide enough information regarding the socio-economic impact caused by COVID-19 pandemic. So here just kind of very brief kind of action that the city have to implement immediately in order to have an overall and comprehensive picture on the potential impact of pandemic in every aspect of the city. We should have a better IT application. Now everything is still paper-based, as Kian also point out. From the planning perspective, but from the pandemic control perspective, we also apply mainly the paper-based system. We also don't have a very clear list of required data and the reporting mechanism. We do not have a enough test capacity and also have not enough the capacity for the healthcare system. The data on the capacity of healthcare system as well. The second bottleneck that I identify that because we missed the opportunity in the past, so we don't have a good collaboration when the pandemic and the outbreak happened. And so during the pandemic, each sector seem to have our objective and action, and there's no many examples to show that there's no effective collaboration and guidance for all stakeholder involving in this. So in order to overcome the collaboration bottleneck, I think that I really like the presentation from Dr. Yao that we should apply as soon as possible the resilient mindset, the resilient concept, and prepare right now to have a long-term resilient strategy towards some kind of build back better strategy, right? And in order to build up resilient strategy for Ho Chi Minh City, I identified 4 main pillars for a resilient Ho Chi Minh City in the upcoming time. The first pillar is the treatment mechanism and standardization for the COVID-19 case. The second one is a different action and policy regarding pandemic control, including, for example, vaccination testing. The third one will be the social security policy that should be continuously support the affected people, especially the vulnerable group. And the third one will be the set of policy that can help to reopen the city and to enable a good condition for economic development and production. So based on the 4 pillars like this, and based on the mindset of resilience, I propose a more concrete and precise action plan for the short term up to the next few weeks, mid-term up to the next few months, and long term up to the end of next year, based on the 4 pillars like this. So as a very brief introduction of from the very recent study that I conduct, thank you very much, and I hope that we can have an interesting discussion later. Thank you.
Thank you very much, Dr. Sơn. I think that your sharing is really very interesting and also come up from the idea for not only in Ho Chi Minh City or Vietnam, it also should be applied to the other city in the other developing countries that have to be thinking about how we make the city resilience. And we also can combine this with the strategy, the plan, the theory, and so on. And it also should be combined not only from the representative of local authorities, should have to be combine or participate with the other stakeholder, where we can get more power and more success when we go to that one. It means that we involve more participate from the own. So thank you very much for all of the informative presentations. I think that this is really very interesting that we also can have the perspective from the very specific location where we have to face on with the COVID-19 from Mr. Kin and Mr. Hai. And also we also have the very overview and general information that can get back good in the COVID-19 from the Ms. Giles, and also with the some proposal from Mr. Sơn. So now I think we also can move to the second part of our workshop. As I mentioned earlier, all of us will be divided random into 2 breakout rooms, and each room will have the maximum of 15 minutes. One of our organizers will guide you through the discussions. All your ideas will be noted by organizer in Miro. So what we discussed in the following is going to be on the 2 questions. The first one, which tool that should be recommended to develop city resilience, especially for the man-made hazards for emerging cities like Ho Chi Minh City. And the second question, we also want to raising the role of the public and also the private sector in the building resilient city, and how we should promote the private sector to participate. So I hope that you will have the enough time and also exciting discussion in the break room, and we will see you there. And after 50 minutes, all of you will be invited back to the main stage, where we also have the maximum 2 to 3 minutes to have our wrap up in each group. So see you there. Hello, everybody.
Hey.
Hello.
Yes, I think I see we have quite a lot of people. We have the 23 people here. Some very familiar place. In the beginning, we proposed that we will have some quick present ourselves, but now the time is having some limitation. We have only 50 minutes, so I think we also can rendering the question. So Mr. Quang, can you share the Miro bot? So I think when we have your idea, you also can first introduce your name and your title, like you work in the private or public sector, so we also can clearly understand your point of view from the different. So I think, like we mentioned earlier, that we want to have the discussion with the two main discuss where main question where we also can get more feedback from you to improve from our side in case of the Ho Chi Minh City. So the first question we have the one you get the recommended tool to develop the city resilience, especially now right now the man-made hazards like a COVID-19 for the emergency city like Ho Chi Minh City. So we would like to provide or to get back the information in the three pillars. The first one is the policy. So I think that we really want to see that how we get the policy, or do we need the flexible or the adapt policy for the local context or for the long term to develop, because that you also can see for the pandemic when it's happened, we cannot follow with the global direction because a different local context will have the different issues. And the second one, we also want to discuss about the technical tool, such as like a mobile app or innovative platform or forecast models that we also can adapt quickly in the emergency situation like COVID-19 or the other pandemic. And the third one, we also discuss about the data, because we know that the data is very important. But in the Vietnam and all of the developing country, the data is not easy to access. So we also want to discuss for the data list, the data collection, or the data usage, or the role of the IT, how we can make this and we can make it more simplified, and we also can use this to propose. So I think now is the time that we want you to encourage all of you to share your idea. Okay, and Mr. Quang will be try to write some words here. So I would like to invite somebody want to start with the sharing, please.
Oh, I think that I have interesting for the data because as everyone
Okay.
know, yeah, I am Newton
Yeah,
from
so welcome.
Ho Chi Minh City. Well, we have a lot of issue when we start collaboration with MIT, especially for the evidence-based data or the real-time data. In Vietnam, it's very difficult for have full data, or it's very difficult to get the access to the data. For example, for this COVID pandemic, if we want to have the right time reaction to the data, we will need to know how much people get affected, how much people or poor people need fund from the government. But we don't have that list of the people. Everyone need to register at the local authorities, and the local authority submits to the higher level. It takes time. It takes 1 month, 2 months, and right now 4 months have passed. A lot of people has not received their funds, the money that the government promised to fund us. So the data is really a big issue for us. Yeah, especially the list of the people need support. Yeah.
Okay, so I think it's also interesting, and also I would like to invite the other perspective that you also can share with us.
Yeah, I'm gonna jump so I can break the ice. Luis Alonso from MIT Media Lab. I think most of you know me. I think Nu, she's totally right. I think the gathering the data is something very important, and probably it's not only about the government or all the technical challenges. It's also like safety and security of the data. If the people wants to give the data, also data kind of culture of data. So like in places like in Guadalajara, sometimes they can give very easily the data, the citizens, because they maybe they are not used to know, like maybe dangerous, maybe not. So that kind of things are very important. But I think the most important thing is the policy, because in this kind of moments, like with when we are facing COVID, some of the policies are unclear. How are they effective or not? How much can you like? There are a lot of measures that we don't know because the virus is so new that a lot of the challenges that we are facing are very new. So most of the time the policies are slow, and some of the time we implement some kind of policies that they are already out of date and maybe they are not as useful as other policies. So So I think that that's also a revision. So when we make policies, we should also think about rapid deployment of some of the policies and flexibility on the policies. So if it doesn't work based on the data, maybe we could change very quickly into new other options. So I think the technical tools are the less challenging here, but the data and the policies and implementing the policies, having all the political parties or all the let's say unlikely partners like working on the same direction, that's usually the challenge. And I think that's humans at the end of the day, no, like gathering the data from the humans and implementing these policies with the humans. I think that's the challenge when we face a pandemic, a global pandemic actually.
Yeah, I also agree with Louis sharing. I will encourage the other people from the other perspective, please.
Okay. Yeah, I have another point of view. Maybe because I work in the government sector, so I feel that policy is the most important thing in these three pillars. Data is tough, tough issues, but in the case of Ho Chi Minh City, in particularly in Vietnam in general, policy is the most bottleneck, the most difficult thing that we have to resolve. At the beginning of the collaboration with MIT, you require us to find the call record data, right? First, because of the regulation in Vietnam, it's impossible to collect that type of data. And that story also happened with Manytin and others type of data or something like that. I would like to tell a story related directly to the COVID-19 pandemic. When the city made the widespread testing, the policy has been changed reluctantly and not stable. Like we have about 2 weeks for widespread testing, that we test for 100% of the population. But then we have 2 weeks or a month without the widespread testing. And you look at the data and you see there is a specific period of time, a lot of cases. But during the last one, it dropped down significantly. And then when we come back with the widespread testing, it's going up sharply. So it's really difficult to work with that type of data because it does not reflect. This is not stable collective. It has not been collected stably and not good for the scientific research. So I think that the policy is important, and we need to have a stable and well-organized policy so that data will be open and accessible for everyone and can be collected well. And technical tool is I think is the easiest thing that we can resolve in the three pillars.
Thank you, Mr. Kim. So I think the time is not enough for all of us to discuss. So I think we also can move to the second question, where we discuss about the role of the public-private sector in building the resilient city and how we promote the private sector on that. It means that we can encourage them with the level of the commitment to the participation. And also, what do you think for the style like the PPP, public-private partnership, or PPPP for public-private people partnership? What do you think that it should be better to use and to apply? So, yeah. So please, someone want to speak up?
I think that from the private sector point of view, we always stand up and would try to contribute our best to the societies. And you see, for the past 4 months in Ho Chi Minh City, a lot of private commercial building, a lot of private land or building change quickly and fast into the field hospital, temporary hospital, and we support a lot in money or in equipment, a lot of vaccine, kit tests, and everything. But one of the question that the private sector will have, like we would like to ask Mr. Kien, if the private sector provide a lot and support society a lot, after that, how can we balance uh, with the issue that we have invest, like we invest into the commercial podium, we change the commercial building into the field hospital. What should we do after that? From the government officials, what do you think?
In my opinion, government sector and private sector should share both of benefit and risk. During the pandemic, we can see that the private sector has support the society a lot. Without support from private sector, for the vaccine and for the field hospital and other facility, government care will not be able to solve the pandemic alone. But I think in terms of urban planning, it should be more flexible and support for the change like what you have done. Like you build a field hospital in your land, and but in the emergency case, it is possible. But after that, I see you will have a lot of difficulty to keep operate those facilities. And I think that's it should have some policies to support that you can keep that building and keep operate it. And it should be better if we decide in advance rather than make it in the middle of the pandemic and have no and cannot predict what will happen after that.
Yeah, I think it's also the quite different issues from Vietnam if we make the comparison to the other country after the post-pandemic when we have to give the more action how we use all of our function in during the pandemic. So how about the other perspective, especially from the other country? How do you think about the 4B, 3P, or the role of the public and private into the city resilience? Can you tell us something? We have only 1 minute left. Yeah. Anyone? We can have this very short. No. So I think we also have some conclusion with our first question that the data is the first important, and also the policy and technical part is also an issue important, but it also support back to the data, and we need to clarify this, and we also can see that the relationship between the PPP and we also can know how the role of the participation. We really need to strong policy to more participate with the private sector in the city resilience, where that the private sector is willing to support, but we need the policy and make the more commit with the own of the activity. So thank you very much for spending time with us. We have no time left. I feel like we're running with the time, you know. Very rush, right? We have to say, and we have to like cross to all of the time. It's really very, very funny. But I hope that with us from our group, we have some feeling. Of course, we expect to have more time so we can discussing more. But I expect that this discussion will not end. We also know that our contact, and we also can contact further and also can discuss further and maybe find some chance to work or further in the near future and exchange our knowledge. So now I will be back to all of the you in the main stage, and now I think that it is time that all of the group also can sharing or wrap up that something that you are got back from the all of mm, uh, the participants. So I think I would like to invite the representative of the group number 2, Dr. Sun. It's your
Okay.
favor.
Thank you, thank you. I have feeling that we have been flying with the time, not only running. Okay.
Yes, yes, yes.
Because that it is just a very short time, but luckily we have enough time to discuss, but very briefly on throughout the two questions. We have about 10 minutes for the first question. We think the different tools that we should apply and initiate to have a better and more resilient city. And we have mainly the sharing from the Western colleagues. For example, the case of New York, that we have a very over there they have a very kind of serious issue on flooding affected strongly the public transit that should be stopped for a while, and so resilient mindset should be integrated into the planning practice over there and also we recognize a very interesting fact that there's different approach and mindset of resilience from the Western context to ASEAN or the Eastern context. And then when we move to the second, I mean the second point of the question, we think that for any kind of application or solution that we propose for a better city, we should have a community, I mean the bottom up approach and thinking about the community and the citizen first. For example, if we want to develop app, to be sure that it should be accessible for everyone, not only for someone who can use only smartphone, for example. We should also have a community agreement and acceptance to use the app, and therefore I think that it is a little bit new for the context of Vietnam. For example, the privacy issue and the trust with the authority is very important because the community will only able to share their information once they trust the local authority or the app developer, right? And also one last remark regarding the data and the use of data in whatever context is that typically we have a lot of data and information, but we should have a good platform to storage the data and also to make use of this platform to share and to develop a good mechanism to send to you the data collected for other urban management and planning tasks, for example. The second question, we have a shorter time to discuss regarding the role of public and private sector, but mostly everyone agree that the public sector or the authority should play a role of regulating and providing the incentive, but also punishing the bad behavior from the private sector in order to make the city kind of more sustainable and more resilient. Also, the private sector should need to have a very clear kind of clear justification from the public sector, our commitment from the public sector, and develop their own solution to make their project and their investment and their area better and more resilient, contributing to the overall resilient strategy and resilient action of the city. One interesting remark that it seems that there is more and more, especially in Western country, in more advanced city, city apply have the simulation part in planning, in planning and decision making process in order to foresee kind of potential output and it will be of an intervention and policy, and then we can have a decision based on the output from the simulation start. So it should be good. Another sharing, I think have some very specific action or item that a private sector could provide and could compromise with the authority regarding kind of a better or more resilient project. For example, kind of a better energy performance for their building, or providing some kind of more socialized space for people within the building. So it is a very brief on the quick discussion that we have from our group. Thank you very much, and thank you.
Thank you very much.
Yeah. Okay.
Yeah, thank you very much, Dr. Stern, and also thank you very much all of the members in the group number 2, because with the very limited time, you share a lot of the interesting idea that we also can learn from this one. So it's me also, we will try to present wrap up something that we also discussed in our group, and we also take the similar situation with the group number 2, that we spend more time with the with the question number 1, that we are discussing about the what tool that we recommend. So the interesting thing that we had the three the people that sharing the idea from the 3 different stakeholder, one from the academic, one from the local authority, and one representative for the private company. So it's quite interesting when we combine. So all of us also agree that the data should be the most important thing, tool that we have to consider for the city resilience, and we have to face with a lot of the difficulty, like how to access the data and how to sharing the data, and the data had to fail with the security, the timing, and the most important thing is the sharing and also the collaborative. And the second thing that we also agree that the policy now is really totally different, and we also need the flexible policy, and it also has to depend in the each area to the area. So normally when we face with something like special, like the pandemic, the COVID-19, all of the policy in all of the countries show up that is the very low and also out of date. So we also need to have the very new, and also this also get the impact to the data, because if we don't get the enough data, we cannot make the flexible and also the adapt policy in the right time. And also the third one, we are thinking about the technical part. Yes, it's important, but the most important thing that if you have the good technical is also the human centered. So it means that we need the good people where we also can dealing and also can work with the data and the policy, and after that technical also can support. So for us, it's also 3 main points, but it also has the impact to the data, the policy, and back to the technical. So it's our first discussion for the first question. And for the second one, when we discuss about the role of the public and also the private, and we also want to make how we make the collaboration on that one. So we also have the representative from the private sector also show up, that we also can see that, especially in Ho Chi Minh City during the pandemic, that the private sector also willing to provide a lot of support, not only the money, it's also the human resources and also support to the other thing during the pandemic. But the question here that when we support this, and this also can contribute for the city resilience or for the sustainable mobility in the near future. So how we can engage them with the commitment level, and how when when the private sector is a contribute, the policy also everything also can supply and also can make it like the good collaboration and more participate on that. It means that we call the win-win for all, not only for one. So it's a really very important issue that we also have to discuss. An example like in Vietnam, it's also the different situation that when we had the pandemic, we also have to build up the field hospital, but we don't have enough money to build up very fast and remove it very quick. So a lot of the private sector support us, and all of the fields hospital and also the other function is also very good one. But now we also have the question that when we back to the or we call post pandemic, how we behave with that one. If we do it, we change this, it will be take a lot of the money. So it means that we need the participation between the different stakeholder, and after that we can go forward, and we can do with a different definition and approach to make the city sustainability. So it's also the some aspect that we quick discussion and sharing with you all. So I think that all of us will have our different point of view to in our mind, and also some proposal. So I hope that this time we also can sharing in the next time, or we also can have the more discussion to make it better. And I think because that the time is quite limited, we have only 7 minutes left before we have to close, because we also have another workshop in the coming soon. So I would like to spend all the time for like 6 minutes for the Q&A. So I also want to all of you just speak up that any question that you want to ask our panelists, or you can put up that in the chat box or in the Q&A or something like that. So the first, the beginning for our Q&A section, I would like to ask Mr. Ken Larsen, because we had a very strong support from Mr. Ken and also MIT colleagues. So what do you think about our situation, and also the all of the challenges that we had to face on, and we deal with that one? So we really want some comment or any question from you to our panelists. Thank you, Mr. Ken.
Yeah, well, thank you. Well, first of all, I just want to say thank you for the excellent presentations. One of the main reasons that I wanted to develop a city science network is so that we can learn about all of the unique and interesting challenges and opportunities in cities around the world, and then hopefully contribute to the development of new ideas and solutions that can address these challenges. And I am thrilled to see how quickly the lab at Ho Chi Minh City has developed. And I'm confident that great things will come from our collaboration. And I'm glad that there was a focus on the pandemic. I mean, we're all aware of the difficulties that come with the pandemic, but in crisis also comes opportunities. And this workshop has made clear that all of our colleagues at Ho Chi Minh City are responding in creative and impactful ways to take advantage of this big reset, you know, to use this time of disruption to rethink the old ways and to build better and more resilient and livable communities. So again, congratulations for putting together a terrific workshop. Thank you.
Thank you very much. I thought that we had more time, but I think we have only 1 minute left, because we also had another workshop. So I hope that this we have to be end this workshop, is a Vietnam workshop here, with a very strong support from MIT and also Taipei and also the other colleagues. But I hope that it's not end. I hope that we also can keep the connect, and we also can have the discuss for the further collaboration, and any chance we are welcome for that. So one more time, thank you very much all of our dear colleagues, and also all the participants spend time with us, and my very grateful to all of our panelists to spend time and also present with us a very beautiful presentation that we also can not only learn from you, we also can learn from the other participants. So thank you very much, and I hope that you will be very helpful and very happy, and also and thank you and goodbye.